My name is George Cheng. I'm a practicing interventional pulmonologist in San Diego area. I work with a large academic institution there. I lead their interventional pulmonology program. I've been in the field for about a decade now. Medical thoracoscopy, or also known as pleuroscopy, is a minimally invasive approach where we insert a camera into the patient's pleural space for inspection, for diagnosis of undiagnosed pleural effusions, and also for therapeutic delivery, such as pleurodesis. The indication for medical thoracoscopy is ever expanding. When we first started doing medical thoracoscopy, it's largely for diagnosis of pleural disease infections, and this was over 100 years ago. More recently, we are focusing on diagnosing nonspecific pleural effusions, namely exudative lymphocytic predominant pleural effusions. Medical thoracoscopy is performed usually with a single port, and often the patient is under moderate sedation, not intubated. So it's minimally invasive, much more comfortable for the patient. The downtime is very low. Sometimes when patients come in for just diagnostic pleuroscopy, they go home the same day. So when we speak to our patients and explain the procedure to them, they actually are quite receptive because they often have been struggling with pleural effusion for quite a long time, undiagnosed pleural effusion. They want to get an answer. And medical thoracoscopy or pleuroscopy allows us to get the highest yield when it comes to diagnosis of unspecific, undiagnosed, nonspecific pleural effusions. I was aware of Richard Wolf's thoracoscopy set ever since I was a fellow. I've been fascinated by its elegant design, and always was looking forward to use it in my practice. And we've been very satisfied with the set's capability, the ergonomics, and the minimally invasive consideration when it comes to using the set. The Richard Wolf 5.5 millimeter outer diameter thoracoscope is uniquely designed because it also integrates a 3.5 millimeter working channel. It is very reminiscent to a bronchoscope, to be frank. So it's easier for us to adopt because you can pass tools right through the working channel. This is where the Richard Wolf Mini-Thoracoscope really shines. Because you have the working channel integrated into the thoracoscope, and the tools are very well thought out in terms of the ergonomics, the design, and the electrification of all the tools that's available. All of this provides us a way to seamlessly perform all the necessary diagnostic and therapeutics that's needed through a single port. All the tools at Richard Wolf that's within the Richard Wolf set that's available for me to use for my patient allows me to provide safe, easy access to the pleural space, allows me to get larger pieces of tissue, and if there are bleeding, I can intervene with electrification of the tools. So colorization becomes routine for us to do, and also in terms of the optics, in terms of the integration of suction catheters into the pleural space, it just makes it an easy to do procedure. The ergon, i.e. ergonomics, is truly fantastic. The different handles that are available for us to use, the way that the instrument spins 360 degrees without you needing to move your hand and wrist in awkward fashion, just makes it easier for you to use the tools that are provided for you. So it's just a pleasure to use, and it allows you to really focus on the procedure itself and not really focusing on how I need to protect my own wrist. I would say give it a shot because I've used it for the past 3 years, and I can tell you from my personal experience that it really has changed my practice. It made pleuroscopy easy. And more friendly to the operator. It's easier to teach the next generation of interventional pulmonologists. We have a interventional pulmonology fellowship program at our practice. And the way that it allows us to get into the space, the way that it allows us to get easily to obtain the tissue, not only decreased the difficulty, but also it increased our procedural satisfaction and ultimately increased our procedural numbers.
Richard Wolf, Spirit of Excellence.